Hi, welcome to the next peoplehub podcast. So this is a series of short podcasts and videos to explore some of the issues that people are facing during the Covid-19 crisis. We're going to be hearing from people with lived experience of personalised care about how their lives have been affected, how they're finding ways to cope, and any tips that they might have that might be useful for other people in similar situations. My name's Robyn and I'm one of the directors of peoplehub. So this week I'm joined by Melanie and Nicholas Cornwell to hear about their experiences. So thank you for joining me, guys. Do you want to introduce yourself and say a bit more about who you both are?
Yeah, so I'm Melanie. I'm from Gate 7 Tyne Weir, and Nicholas is my son. He is 20 years old and he has cerebral palsy, and I'm his full-time carer.
Okay, lovely.
In the background, that's Rupert.
Hi, Rupert. So do you guys have a personal health budget?
Yes, we do. We've had a budget now for 2 years.
Okay, and how do you normally manage that?
CCG. The care and support plan was really focused around the care that Nicholas needs. We use it for personal carers, personal support assistants to come in and help us within the home, and also help Nicholas to access the community. We have an element that is for respite and for short breaks, so you can access St Oswald's Hospice in Newcastle. Nicholas goes there 2 nights a month. And we can use some elements to take him away on holiday ourselves, or we can take a PA, or PAs can take him on holiday. Excellent. We also have 2 days where Nicholas doesn't go to college.
Yeah.
So the funding that last year was paid to his college is now in his budget, and we use that for activities and for care support.
Excellent. And so do you have a team of PAs?
We have 5 PAs. 5 PAs.
Yeah.
One of them works 30 hours a week, and then we have others who work shorter shifts.
Yeah.
And set days. So we've got quite a good cover.
Yeah, excellent. So what's changed for you because of coronavirus?
We've had the Soblin carers in because we had the Soblin carers in.
I think everything's changed. So at the beginning of March, Nicholas was still at college 3 days a week. He would get a taxi at 8 o'clock in the morning, and he didn't come back until 4:30 in the evening. And from then we would have carers at home to support us with moving and handling, feeding Nicholas, changing Nicholas, outings if he wanted to go out, and settling down at bedtime.
Yeah.
We had that at weekends as well, where he was able to go out and spend time with friends and carers. So he had quite a busy social life.
Yeah.
He loves the cinema, loves being out and about, loves spending time with his friends.
Yeah.
We had all sorts planned. He was due to go on holiday during the Easter holidays with 6 friends and all of the PAs.
Yeah.
So we had an adapted place in the Lake District booked for them, which had been looking forward to for a long time.
Yeah.
His respite 2 nights a month at St Oswald's was still ongoing. And everything changed for us on the 13th of March when we had an appointment with the home ventilation team at the RVI in Newcastle. And we were told at that appointment that it wasn't safe for Nicholas to be in contact with anybody.
Right.
Because of his underlying health conditions, and in particular his lungs.
Yeah.
It felt a little bit surreal at that time.
Yeah.
Because nobody else was staying in. There was a lot of information coming through, but the situation that we're in now just didn't fit with what was happening that first week.
Yeah.
So we were a little bit concerned about the virus. We were worried about the numbers that were coming from London, and it was quite minimal where we are. We're fairly rural.
Yeah.
But as things were going on over the week, and they were talking about social distancing and the shutting down of various places, we started to get a little bit more concerned about how we were going to control our little environment where we were keeping Nicholas.
Yeah.
In particular, having carers who were coming into the home multiple times during the day, but also had roles elsewhere, the key workers in other areas. Because Molly works for Nicholas 30 hours a week, but she also works at the school that he goes to.
Yeah.
So we had a little bit of thought about whether school would allow Molly to continue to work with us rather than going into school as well.
Yeah.
and that wasn't a solution that we could access.
Yeah.
By the end of that first week before the lockdown, I think we had made the decision that the only way to keep Nicholas safe was to eliminate anything coming into the home, and the only way to do that was really for us to take that on, and for myself and his dad to look after him at home.
Yeah.
That in itself was, it was really, really anxious time, because I was terrified about what would happen to the PAs, their jobs, their salaries, how I would continue to pay them, whether I was allowed to continue paying them.
Yeah.
And I contacted our social worker at Newcastle and Gates at CCG, and actually he was really good. He was quite reassuring, and he gave us as much information that he had available at that time.
Yeah.
And we just said to the PAs, all we can do is, go home and keep in touch with us.
Yeah. Yeah.
Nicholas loves FaceTime. He loves chatting with people.
Yeah.
And that's what they've done since. They've been on, and every day there's an hour phone call from the PAs. Sometimes they can do Zoom calls and have them all on at once.
Yeah.
Sometimes they ring separately, and they were supporting initially with things like shopping and prescriptions, and doing everything they possibly could just to help out from outside of the home.
Yeah.
It's kind of worked.
Yeah, fabulous. So are you, Nicholas, are you still able to do your college work from home?
Yes. So we've now got, thanks to the budget, like a standing frame that we've just bought.
Excellent.
So I think one of the things that came out with the guidance later, the updated guidance for personal health budget, was the flexibility and use of the budgets.
Yes, absolutely.
And that's certainly something that our local authority has adopted.
Fantastic.
When Nicholas finished college, we lost everything. So every form of therapy that he had and that he really needs on a day-to-day basis was removed as well, and reduced to a phone call.
Yeah.
And that's worrying enough for us, but also for the therapists that are involved with Nicholas, who are supporting him every day to maintain as much range of movement as possibly can get.
Yeah, yeah.
But also because Nicholas has no physical ability to sit up independently, his chest wall is and his lung support is affected.
Yeah.
The strength to breathe, and we can't afford to lose any more of that. So an endless period of time without any kind of therapy. He needs hydrotherapy weekly, which we've lost.
Yeah.
But the access to the equipment that he has at college, we couldn't replicate at home.
Yeah.
We've had to use some of his budget to purchase a piece of equipment that he'd been assessed for at college before the lockdown. And we've been lucky enough to be able to get that quite quickly.
Oh, that's brilliant.
That's been set up by a Zoom call with the rep from the company also taking measurements and doing it. So it's something that's been done entirely different to the way normal equipment would be provided.
Yeah.
But it's given us access to a piece of kit that can help us with multiple position changes through the day for Nicholas, and allow us to continue physiotherapy that he was getting at school.
Oh, that's brilliant. And it's really good that they've been able to do all that remotely as well.
Yeah. It's been through, sending photographs in, getting them to check his posture. So there's been a lot of work that's gone on remotely, but we've achieved it.
No, that's brilliant. That's
just
really
different ways of working.
Yeah, absolutely. So how's it all affected you guys, like Nick, for yourself and for you as a family?
Well, obviously routine is very important.
Yeah.
If I don't have routine, it increases anxiety massively.
Mm-hmm.
I think not being able to see people, other than on FaceTime, and just it's harder because all of your friends are there, but you can't plan things. There's no cinema anymore, and he loves the cinema.
Yeah.
And I think we really decided early on that keeping Nicholas happy was the absolute priority. Keeping him in the house, keeping him well, and keeping him happy is what we need to focus on. And I think we're getting there most of the time.
Yeah, we are.
I think Disney Plus came out. That was a huge bonus, wasn't it? So we watch Disney movies.
Yeah.
And we look at Apple Store, and we talk about Apple products a lot.
Yeah.
An awful lot. And just really trying to get through the weeks.
Yeah.
and just take each day as it comes.
Yeah, yeah, no, absolutely. And family life, how are you coping with that?
I'm shielding with Nicholas, so I haven't been out of the house at all since the 13th of March. I haven't been out the front door. And because we've got building work going on, we can't even access the garden at the minute, so we can't do anything other than just stay in the house.
Yeah.
I find it difficult not seeing family members. When his sister visits, she's a key worker, she's a teacher, and she can't come into the house either. And I found that really heartbreaking, having her visiting and not being able to hug her and not being able to invite her in and spend time with her. It's, you know, a conversation from 2 meters away outside of a window.
Yeah.
It's dreadful. Really, really missing her.
Yeah.
And you're missing her too.
Yes.
Yeah. But she's ringing and reading him stories, so you know, we've become so reliant on FaceTime and Zoom calls, and
no, absolutely.
It's the one thing that's been a huge bonus to us, is having access to the technology that you know is keeping us going.
And St. Oswald's are keeping in contact.
Yeah, St. Oswald's. Yeah, you have a Zoom chat once a week with them, with other parents and other people that stay there.
Yeah.
We did a Beetle drive last week on Zoom, didn't we?
Yes.
Oh, fab. Excellent. And how are your PAs coping? Are they managing to cope all right with working? Because obviously it's a very different way of working for them, isn't it?
I think Molly, who does most hours with us, she's contracted to 30, but usually does a lot more than that. I think she's been really anxious about it. I think she's really missing coming into the home, and quite upset that she knows how much goes on when we're working together, or when she's working with other PAs, and how much we have to do to keep Nicholas well.
Yeah.
And I think that's kind of upset her, that she's not involved, and knowing that me and his dad are doing it all now, which I just try and encourage them to, you know, keep FaceTime and keeping entertaining them and things like that, because that is a massive part, and it's taking a huge amount of pressure off me, just having that, you know, half an hour to an hour a few times through the week to let him spend time chatting to somebody else about the things that he enjoys.
Absolutely. Yeah, absolutely. So what else are you guys doing to keep busy and to keep your spirits up? Obviously you've talked about the Disney Plus and all that sort of thing. How are you passing the time?
Eating good food.
What else did you get? Can you remember? We got a really lucky piece of equipment, didn't we?
We got something called an inner walk.
Oh, what's that?
There's a company called Made for Movement who create the inner walk. And the local rep used to be a physiotherapist at the hospital in Newcastle. She's visited Percy Headley Nicholas's school a few times, and Nicholas has had access to this equipment on a very short term, like maybe it's an hour once every 6 months or something. And it's called dynamic standing, so you're sat in it, and it fully supports your body and your body weight, but it allows you to stand up, and it moves your legs.
Oh, fantastic.
So it's a bit like a treadmill. And they're really, really expensive. They're not something that, you know, normal people can just go out and buy. Having access to a piece of equipment like that is huge. And she contacted us and just said it's sitting in our garage, and it's going to be there because she can't take it out and visit people. And if we wanted it for the period of lockdown, then she would quite happily drop it off and then do a Zoom chat to get it set up. And that's what she did. She dropped it off in the drive. We brought it in, and then she did a Zoom call in the afternoon with Nicholas's physiotherapist from college. And we got the positioning right and made sure he was safe in it, and that I was competent to manage it. And he's in that for about half an hour to an hour a day. We're getting into quite a routine of using this type of equipment, but we feel really lucky that we've been able to use that, don't we?
Yes.
Absolutely. That's amazing.
Yeah, it is. So there has been some positive things that have come out of the situation.
Yeah, absolutely. And how are you guys getting hold of groceries and things? Have you got deliveries with those sorted?
We've got a weekly slot now through Asda.
Fab.
Once Nicholas got his letter for shielding, we were able to register for the support.
Excellent. Yeah.
So we've managed to get that sorted. So that's it. That's a big thing through the week, isn't it? Talking about the shopping list.
Yeah.
And amending it and adding things to it.
Oh, that's brilliant. Good. So have you got any tips for other people in similar situations to yours that people might find useful?
Please stay strong.
Stay strong, Nicholas says. Stay strong.
Stay strong and be happy.
And be happy. That is really important, isn't it? But I think not to become too isolated. And, you know, if anxiety is overwhelming, then you really need to make sure that you've got other people to talk to and finding the means to do that, whether it's speaking to your social worker and being provided with equipment to be able to access the type of things that we've talked about, Zoom calls and FaceTime, and that type of contact can just make all the difference.
No, absolutely, absolutely. And we're all going through it in our own households, but we're all going through it together, aren't we?
Definitely. And everybody's situation's different. So I can sit here with a happy boy and put a positive spin on things, which is sometimes actually really difficult.
No, absolutely. Absolutely. Oh, I'm really glad that you're doing okay, and that you're getting on, and that you've had some amazing opportunities as well through it.
Yeah, we have, haven't we?
Yeah.
Excellent. And it's not forever, is it?
No, I think that's the one thing that we've kept focused on, is that, you know, there will be an end to this.
Yeah. Yeah, absolutely.
We've got lots to look forward to in the future, haven't we?
Yes.
Absolutely. Lovely. So thank you ever so much for giving up your time to talk to me. It's been really lovely to catch up with you.
You're welcome.
And thank you for listening. So we hope that you found this interesting. We'd love to hear your feedback and comments. If there's any particular subjects that anyone would like us to cover, or if you want to get involved and share your experiences with us, then we'd love to hear from you. You can get in touch by commenting on Facebook or Twitter, or you can email me directly at robyn@peoplehub.org.uk. So thank you for listening, and thanks again, Melanie and Nicholas. Take good care, and we'll catch up with you soon.
Bye.
Bye.
Thank you.